Why is it important for me to complete the CNE journey? Why do I even want to achieve my certification as a nurse educator? These are questions that we get all the time. Believe it or not, we actually get this question from directors as well as nurse educator colleagues. And this is the consistent answer that we give. It has to be your why. Now, we can spend time talking about the mark of professionalism and the importance of achieving certification, not only in our clinical specialty, but also as a nurse educator. We know that nurse education is a specialty, and our ability to validate that through a test, an exam, really does put us in a space, put us at a level of competency that we are able to achieve when we pass the CNE exam. In 2023, NLN reported that only 64%, that's right, 64, so about 6.5 out of 10 nurse educator colleagues achieved a passing score on the exam. That is not a goal that we want to highlight because that's not very successful, right? We want to be, think about our nursing school. We tell our students, oh, you need to achieve a 78% on an exam. Or even with our NCLEX pass rates, Board of Nursing says you should be at an 80% success or pass rate. So why is that any different with the CNE exam? Well, we are here to support you on the journey to CNE success. And it's a journey for a reason. It took me almost 8 years to get CNE off of my bucket list. Yes, you heard me correctly, almost 8 years. And the reason why is really twofold. First of all, I didn't know where to start. I didn't know what resources to use. And second of all, I had a little bit of fear of failure. Okay, how many of you can relate to those feelings? Well, at Dr. Sellars Educate, you don't have to worry about those frustrations, those concerns, or those barriers to success. Our mission is to support you on the CNE journey until you are successful, no matter how long that takes. All right, so speaking of no matter how long that takes, this is our final session in looking at some of the questions that we have gathered and collected during our in-person sessions, during our masterclass sessions, and even during a pre-conference session that we had over the past month and a half. All right, so here are our next questions. This one says, if you take the CNE clinical and want to move into classroom teaching, should you wait and take CNE? So this is an excellent question, and our recommendation is yes. Now, we recommend that you first go to nln.org website, take a look at eligibility criteria for CNE clinical and CNE to determine which exam really does align with the work you're doing right now. Okay, so look at the eligibility criteria, number one, that's included in the handbook. The second part we want you to take a look at in the handbook are the competencies. Actually look at those 6 CNE clinical competencies and the 8 CNE competencies. Look at those behaviors associated with each of the competencies, and that's going to be a strong indicator as to which exam you should take first. We do hear several colleagues that decide to take both of the certification exams. We think, of course, that that's a great pathway to success and a strategy for success when you think about achieving nursing excellence in the classroom as well as in the clinical space. All right, the next one says, should you take the CNE novice or wait and take CNE? Is that taking the exam twice? This is another great question. CNE novice was designed by NLN for those nurse educator colleagues that have less than 3 years of experience. Okay, so if you have less than 3 years of experience, then yes, we recommend the CNE novice. And what's going to happen at the end of the 3 years, it's not renewable. You will have to take the CNE, okay? And if you're wondering if you can take the CNE clinical, we recommend that you reach out to NLN to clarify that question because we're not sure if you can take the CNE clinical after you have the CNE novice or not, but NLN will know. And it's 2 totally different exams, so no, you're not taking the exam twice, okay? And the other point I will make about CNE novice, because we get this question too, what's the difference between the two? Well, first of all, because CNE novice is designed for colleagues with less than 3 years of experience, there's not a lot of focus on curriculum revision. There is a focus on curriculum development. And then the other area that there's not a strong focus on is exam analysis. However, there are questions that you should expect on assessment and evaluation. All right, so let's take a look at a few other questions. Says for nurse educators who are strictly hospital-based with other nursing backgrounds progressing to CNECL, what should my next steps be? Great question. So if you're hospital-based, which we know some colleagues are, we are happy to support you on the journey to CNE or CNE clinical as well. This is the first step. Go to the nln.org website, print out the candidate handbook for CNE clinical. Okay, in fact, let's go there together. All right, so what you want to do is, I'm just going to pull it up first, and then I will share my screen. How many of you have already been to the NLN website? All right, go ahead and put that in the comment section. We do check our comments. Yes or no, have you been to the nln.org website? All right, we always like to know how many of you all have. And what you're going to do first, just going to nln.org, as you can see on my screen, you're going to click NLN certification. And then on the left-hand side, you're going to choose whichever CNE exam you're on the journey for. All right, so if you click on CNE, you will see once it opens that there's a handbook right here. There's also guidance on the left-hand side. Let's go back. On the left-hand side for resources, so you can see right away, super easy to get to, what other resources are available to you related to your journey to achieve the CNE. The other point I want to make that we just realized actually yesterday when we were completing our study success plan 3-day series is that now NLN has updated self-assessment exams. Okay, so this is great because if you are on the journey and you were thinking about taking the SAE, I think now is a great time for you to commit to that, especially if you have a lot of test anxiety. The SAEs are a great resource to be able to engage you in a way that is similar to what you'll experience with the CNE because it's a standardized test in the sense that it's on the computer, you're answering questions. And then the second benefit is at the end of the actual SAE, which we'll go ahead and click on it, you will be able to see your score report. Okay, now NLN, big strong disclaimer, success on the practice exam does not guarantee positive results on the certification exam. Okay, so there's no direct correlation. However, you do get the scoring report, you do get experience with taking a computerized exam. It is $75 right now. So the price did go up just like everything else, right? And there are 65 questions on the exam. If you have other questions about the SAE, reach out to NLN. They're your best resource. All right, so you're going to click on the candidate handbook. If you're on the journey to CNE, then you would click it for that respective exam. And then you just want to look through and make sure that you are, first of all, knowledgeable about what the CNE clinical exam entails. And we recommend that you print it out and we want you to read it cover to cover. Now, there's a reason for that. First of all, the commissioners spend a lot of time developing content for the handbook. And second of all, the exam writers are actually involved in the process as well. Okay, so we want you to print it out, read it cover to cover, because any content from the handbook, you could see it show up as a question on the exam. All right, and then the last point we want to make about the handbook is that there are 150 questions on the exam, and 130 of those will be scored, 20 will be unscored, and we don't know which 20 are unscored. So you want to treat every exam question as if it is going to be scored, okay? And you do have 3 hours to take the exam, 150 questions. We recommend going to a testing center because you're going to have a proctor there and it's going to be a more controlled environment. Okay. All right. Last few questions. Item analysis. That's all we have. So this is what we would say about item analysis is to take advantage of the item analysis assessment. If you go to our website, drsellars-educate.com, you will see exam analysis and we'll go there together. You will see an exam analysis assessment that is available for you to go ahead and take and see where your muddy points are to help you kind of guide yourself on your journey. So you can see right here on our website, take free exam analysis assessment. All right, so just your name and your email and then click Get Now and it will be emailed directly to you. Okay, great resource. And then the other resource I want to point out is the 10 biggest mistakes. Have you all heard that we have a new ebook? We're really excited about it. So we collected data from hundreds of nurse educator colleagues across the country, some that were successful, some that weren't, some that have taken our review courses, some that haven't. And we nailed down what are those top 10 biggest mistakes. And most importantly, how do you avoid those? What tips can you follow to help you not make those same mistakes? So this book is rich with content. This ebook is, you can print it out There are hyperlinks in here. It's really going to give you a great foundation to move forward on your journey. All right, so let's take another look at a question. Discrimination with test items, how to interpret. Remember, discrimination is all about separating the high-performing test takers and the low-performing test takers. We want to be able to discriminate by developing not only evidence-based questions, but also effective distractors that are going to attract those students who are not knowledgeable about the content. And we want our students that are knowledgeable to be more attracted to the correct option than those students that are not knowledgeable about the content. Okay, so what you want to know about discrimination and all of the different variables associated with exam analysis is three things. Number one, what is the definition of that term? Second of all, what is the range? And third of all, what are you going to do about it? Okay, based on the range, if it's high or low, what story does that data point tell you about how students have performed on the exam? And then what are you going to do about it? What steps are you going to take based on that data point? All right, a few more. Stay with me. Learning theories. Need help to break it down. I know learning theories can be a challenge. 6th edition Billings and Halstead Table 14.1 is going to be your best resource because it gives you a description of the learning theory. It talks also about teaching strategies and then, most importantly, alignment between those teaching strategies and the learning theory. And here's a hint. Case studies as just one example, it can actually cross over into 3 different learning theories. Okay, so just make sure you're clear about the definition, the underpinnings or tenets associated with that learning theory, specific examples, and how it aligns, those teaching strategies actually align with that learning theory. And the next one, who would have guessed, is exactly that. How do I correlate learning theories and domains to actual classroom and clinical learning strategies? Great question. Billings and Halstead, you all already knew where I was going to refer to. Chapter 16 gives you a wealth of information about active learning strategies. And then chapter 19 specifically hones in on clinical teaching strategies, okay, that we should use that are evidence-based to best support our students. Learning domains, that's going to be pages 188 through 190 in the 6th edition. And when you look at this resource, it's going to break down the learning domain definition, the taxonomy, the different levels, the verbs associated with it, as well as some great examples of how to write those learning objectives that are going to align with the different levels on the taxonomy. The next question is, can you explain competency-based curriculum design? Excellent question. So these are the 2 tips we would share about curriculum design, specifically with competency-based. First of all, with competency-based, we want to begin with the end in mind. It's called the backwards design model. That allows us to think about what learning do I expect my students to be able to walk away with as a result of my ability to facilitate and really coach students related to those specific concepts. So we begin with thinking about, okay, my learning objective for today is to highlight questions that have been previously submitted by colleagues across the country. And the goal is that you're able to walk away with tangible information with clear direction about how to move forward. The reality is, listen to this point, we know that it's not only 300 or so nurse educator colleagues that have these questions. We realize that there are probably thousands of you all out there that have the same questions. So we want to maximize the time that we're spending together by answering these questions using the evidence. Okay, so our backwards design model was we knew there were questions out there. We know the content that is in Billings and Halstead. We wanted to bring that to you so you can move forward by collapsing time, right? That's our goal, and moving forward to achieve success on the C&E exam within 60 days. We don't want it to take you 7 or 8 years, and for some, I know, even 10 years, okay? So backwards design model is number 1. And then the second part about competency-based education is what's called criterion referencing. So we set a benchmark. This is what's required to validate competency. Anything below that, we do not validate competency. Okay, so it's very clear cut. It's based on criteria that we establish that students have to be able to meet. All right, a couple more and then we'll be done. How do you choose which exam? Great question. Well, we've talked about that, right? So go ahead and write down. If you haven't already, you can go back and watch this snapshot to recap again. How do you decide which exam to take? All right, and then last question or last comment, that they are very nervous about the nursing theories. I know. Well, here's the reality. There's probably going to be maybe 8 to 10 questions that are aligned with learning theories, and our best ability to be able to recognize the correct answer is going to be based on our ability to apply these learning theories in our everyday practices, right? Experience is the foundation. And we build on that by looking at content in Billings and Halstead in Chapter 14 to align my teaching strategies, such as unfolding case studies, such as flipped classroom models, such as reflection and discussions. I'm going to go back and look at Chapter 14 and figure out which learning theory do these teaching strategies actually align with. Our ability to engage on our journey towards achieving C&E success is mostly aligned with the ability to apply and to analyze these concepts in a way that will allow you to achieve success, achieve that passing score on the C&E exam. We hope this snapshot has been helpful. Thank you all so much for giving us questions that we could answer for colleagues that, again, we know thousands of you probably have the same question, but here's the most important point we want you to walk away with. We know that the C&E exam can be very intimidating. We know that it can be overwhelming. We are here to support you on your journey to C&E success, no matter how long that takes. The only way you will not achieve success on the C&E exam is if you quit. Reach out to us if you have questions, info@drsellarseducate.com, and we look forward to seeing you next time. Have a great one, everybody.